allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, bear with me. I have prepared talking points I haven't read through yet, so this is the first time for me. We are here today for a special meeting to discuss COVID-19 and necessary county business. We're going to hear some brief comments from Martin County Fire Rescue Chief Bill Schobel, and an update from Emergency Management, and discuss county operations. I'd like to take this opportunity to thank our residents. Right now, everything, as we know, is changing. As families, we learn how to work and go to school much differently than 2 weeks ago. As business owners, we're adjusting our business model to meet the current needs of our customers. And as county leaders, we are continuing to navigate this rapidly evolving event and adapt our processes and procedures to keep our community as safe as possible. Before we begin, I would like to take a minute to thank all of you, medical personnel, caregivers, and first responders. These folks are working tirelessly for our community, spending time away from their families so they can care for ours. I would also like to commend all of the not-for-profit partners and local agencies for all they are doing to make sure our friends and neighbors are fed, educated, and supported during this difficult time. And on behalf of the board, I would like to thank our staff for making adjustments to their lives and how they do their jobs so we can continue to provide services for our residents and visitors. And on a final note, I wanted to remind everyone to be kind to each other. We are all in this together and need to support one another. We are resilient, and we will get through this and become a stronger community. Thank you. We're going to start this morning with a update we're going to do public comment after our presentations. So everybody gets to hear that first before they do their public comment. First, we're going to begin with emergency management. Michelle?
Mr. Chair,
Yeah. Oh, I'm sorry. I'll get it right by November, I swear.
I make a motion to accept the agenda as presented. Second.
Okay, we have a motion by Commissioner Campy, seconded by Commissioner Smith. All in favor?
Aye.
All opposed? Motion carries unanimously. Okay. Michelle.
whatever you want.
Good morning. Michelle Jones, Emergency Management Director. Thank you for having me today.
Speak in the mic.
Speak in the mic.
Sorry. Better?
Yes.
Perfect. Good morning, Michelle Jones, Emergency Management Director. Thank you for having me today. First, I just wanted to echo Commissioner Jenkins' comments. We are incredibly thankful for all the county departments, our local municipalities, nonprofit agencies, business agencies, and our state and federal partners that have really worked with us and supported us through this. Today, we will re-sign our local state of emergency to continue to close beaches and allow for the county to continue operations and services in an altered mode so that we can continue to provide for our community. The Emergency Operations Center is now at a level 1 full activation in support of these operations. We have been conducting virtual operations for the last 2 to 3 weeks and have been hosting virtual daily EOC briefings, Emergency Operations Center briefings for all of our partners to keep our folks informed. The Community Information Center is available to the public from 7 a.m. to 6 p.m. daily by calling 772-287-1652. And that's where any resident may call and ask questions concerning COVID-19 or any county openings or closures that they may look for more information on. The school district moves to the digital instruction plan today, and we send positive thoughts to all of our teachers and parents as they work through that process. And on the daily report you can see here, there's also an email address where questions can be directed in case parents or students have questions on that virtual instruction plan. We've been partnering with the school district, Boys and Girls Club, House of Hope, Salvation Army, Elevate Hope, Meals on Wheels through the Kane Center, TC3, Family Promise, Humane Society, Treasure Coast Food Bank, United Way, the Community Foundation, Children's Services Council, LaHaya, Gertrude Waldron, Red Cross, and 211 to collaborate to answer all of our community's needs. We've been focusing on food distribution, and financial assistance. And if we have any member of our community that needs those services, we encourage them to call our Community Information Center at 772-287-1652 to be directed to the appropriate agency. United Way of Martin County has set up a COVID-19 relief fund to support our community's recovery efforts for those who can and are willing to donate, and working with those other nonprofit agencies to provide those funds. Floridians who employment have been affected by COVID-19 can apply for the reemployment assistance benefits. That information is on our website, martin.fl.us/coronavirus. And the Martin County Business Development Board has created a COVID-19 Biz Hub to centralize all current information to help community businesses navigate the local, regional, state, and federal resources. That link is also on our website. We encourage residents to follow the CDC and FDOH guidelines to stay home when sick, and really stay home as much as possible. Leave when needed for groceries or required activities, but stay home otherwise if able. We continue to echo the Florida Department of Health and the CDC guidelines to wash hands, cover coughs, and avoid touching your face. We also encourage everyone now to discuss with their families how they may take care of sick family members while trying not to get infected or exposed to the coronavirus. And there are resources on this on the CDC website. And please keep in mind, we're working with our utilities and FP&L and our grocery stores to keep the power on, the water flowing, and grocery stores available. Now's not time to panic, but to choose compassion over fear. We're asking everyone to take this time to take care of one another, stay home if able, connect virtually with family and friends, and with us on Facebook, Twitter, at Martin County Gov, our website, martin.fl.us, the Community Information Center at 772-287-1652, or by texting Alert Martin, one word, to 888-777. We've been working with the Florida Division of Emergency Management to gain or seek additional resources for our community. Over the last 2 days, we've gotten two shipments in, and we've been able to distribute those to all of our partner agencies that have requested, including the assisted living facilities, skilled nursing facilities, the hospital, and our first responder agencies. Almost all of those agencies have received some form of resource requests, N95 masks, surgical masks. We've been trying to get those out as quickly as they come in an equitable way, and so those resources are going out today and tomorrow. That is
Ms.
the
Jones?
information I have. Yes, sir.
Question for you.
Yes, sir.
I appreciate the supplies that are coming in. You had mentioned several different organizations that are getting supplies. I think some of our urgent care walk-in clinics have also received supplies. Are they part of that distribution?
Yes, sir.
Thank you very much.
Any additional questions for Michelle? Michelle, you're doing a great job. Thank you.
Thank you.
Next up, Mr. Rob Lord, Cleveland Clinic. Yeah.
Wherever you want, Rob.
Yeah.
Just have to speak right in the microphone, that's all.
Thank you. Mr. Chairman, Commissioners, my name is Rob Lord. I am the president of Cleveland Clinic Martin Health. I want to thank, first of all, you for the opportunity to speak to you. I also want to thank the Emergency Operations Center and your entire team for the work that you're doing. Carol Ann and the Florida Department of Health from Martin County doing a fantastic job. Cleveland Clinic's physicians and leaders have been holding regular multidisciplinary meetings for about 3 months in anticipation of this event. We've been working to manage our supplies during that time, trying to make sure that we have resources to protect our patients and caregivers today, but also to make sure that we have the ability to protect them as we move into the future, as we face the expected surge. We currently have adequate supplies, but that does not mean we will not need more as we move on. In fact, we most certainly will, if projections hold true. So we are trying to conserve those resources for that surge. We're working closely with public health officials on the local, state, and national level. Cleveland Clinic, Florida is closely working to develop contingency plans for a number of contingencies, knowing full well that we need to be flexible and adaptive in uncertain times, and these are certainly uncertain times. We do have some plans to expand our patient care areas within our hospitals in the event of a surge in order to create more capacity and to work on additional contingencies in the event we're unable to hold the patients within the 2 hospital facilities we have in Martin County and the hospital facility we have in St. Lucie County. We've been on daily calls with the emergency management team to provide updates and ensure collaboration. We're also working with the Department of Health options for setting up alternative care sites if necessary. We're also taking as proactive steps as we possibly can to minimize exposure for patients and caregivers. The things I'm extremely proud of is on March 14th, we opened up a drive-through facility at Martin North where people could get tested. Now, in order to do that, they need to call a triage line. We have triaged over 5,000 Martin County residents through that triage line. We also added additional drive-through locations, one at Tradition in Port St. Lucie, and there's another in Indian River County at Indian River Hospital. If a person meets criteria, they will get an appointment, and they drive through at that location. They never have to get out of their car. Through that, as of yesterday, we have screened, as I said, approximately 6,000 people by phone. We've tested more than 500 Martin County residents. Now, some of the numbers I'm going to give you are not reflected on this screen. We're reporting it to the Department of Health, but when I see the total tested up there, I'm pretty sure those are results that have come back. So we have tested over 500 at the drive-through location alone. This process, we've been able to keep people that have symptoms out of emergency departments and out of physician offices and reducing exposure to others. As for results, including our hospitals, physician offices, and the drive-thrus, we've tested a total of 634 people from Martin County. Of that, we have 236 results in. We have 398 tests pending, 22 positives, and 214 negatives. I believe there are 27 total positives for Martin County. Commissioners and to the residents of the community, first, I know that there's a lot of frustration with the lag in getting test results. Our organization shares that frustration. What we do is we take a sample from a patient, putting it in a vial that has a medium in it to preserve it, and it is shipped to a commercial laboratory. And then we wait for those results. Initially, we were told 3 to 5 days, but it's taken considerably longer for that. Since the volume has grown and it's exceeded their capacity to process those tests. We are working with those labs, and I know that they are feverishly trying to increase their testing capacity. We also have virtual health care available to our community now. I'm very excited about that. That may be a change we see that's one of the good things that comes out of this. You can make a phone call or get a video visit. It reduces the risk to the patients and to the providers. We have an app, Express Care Online, that can connect individuals with a physician by phone or by computer. It's important that I note to members of the community that we have eliminated all copays and deductibles and fees associated with that service so that anyone can get access to that service. And again, very proud that we're able to offer that. We have postponed all elective surgeries and non-essential procedures. Now, surgical cases that are emergent or urgent, such as cancer surgery or evaluation of cancer or an infected joint, those surgeries go forward. We're still doing those. But many other indications are being delayed. If a physician and patient determine that a surgery is necessary at this time, we are doing that procedure. But this allows us to reduce our occupancy in our hospitals to conserve our personal protective equipment. while also minimizing exposures to patients and caregivers. Last week, we put in place some extraordinary restrictions in visitation. And again, I want our community to know we're not doing this out of a lack of compassion. But it is to protect the patients and the visitors and our caregivers. And that includes both inpatient and outpatient settings. If you show up at our hospital and you are entitled to come in and visit, this also applies to caregivers. I did it this morning. I do it every day. I stop by the front door. I have my temperature taken. If I'm running a fever, I will not be allowed in the building. And I'll close. But this is a unique situation. It is rapidly changing. As I said before, we've been preparing to manage this situation for the last 3 months. We are fortunate that our organization has a seasoned, I will call them, group of emergency managers to help lead us through this process. And across the Cleveland Clinic and the Cleveland Clinic Enterprise, one of the things that has been remarkable to me is some of the world's greatest experts in some of these areas work in the organization that I'm now part of. We also have some extraordinary experts in emergency planning and supply chain management. But we know our system will be tested locally and across the state. To the members of this community, I would also say, as someone who's worked at what was Martin Health and is now Cleveland Clinic, I wish I could say I planned this or I could foresee this, but we are so much better off today than we would be if we were a standalone independent hospital in terms of getting supplies and being able to work across this network. And I'm very, very grateful to the community for that. We've been tested before here, though. Half a dozen times or so, I've gone into emergency management for a hurricane. I've stood in the eye of 4 hurricanes: David, Francis, Jean, and Wilma. Many of you will remember back in 2004, the roof came off of North Hospital and the penthouse around the elevator equipment was destroyed, and we basically shut down the North Hospital, or at least the North Tower. But with your help and the help of national and state leaders, we were able to make it through that and, in fact, come back stronger, have a better hospital in the end. And I have every confidence that would be the situation here. I'll be happy to answer any questions.
Commissioner Hurd.
Yeah, first of all, Mr. Stokas, would you please close the blinds behind you? I can't see the speakers, and I don't want to miss anything. Thank you. Mr. Lord, I think that you've pivoted wonderfully. I've been very, very pleased with the response that we've seen from Cleveland Clinic. But you do have limits, and one of those is that you are not doing your own lab work when I know full well that you have labs that could be taking care of the testing. Why are you not?
Well, first of all, I don't want to editorialize. Our country was, I think it's been well publicized that we were late to the game when it came to testing and the first test kits that came out. First we decided as a country to design our own, and when we designed it and it came out and it didn't work, and it required specialized equipment that most laboratories didn't have. Now, as some of the new tests have come out, we do have some equipment that could run lab tests, but we're having difficulty getting the test kits. We were scheduled to receive an order of those early this week, and those supplies, as I understand it, were diverted to New York City. So we are working, but we are on a couple of different fronts, a couple of different types of tests that have now been approved. We are looking to be able to perform those tests. Now, if we get test kits that we can run, but I get a limited number, if someone said, here's 250 test kits, we would use those first on the inpatients. Right now, in our facility, we have at North 14 patients that are what we define as persons or patients under investigation. And they have to sit in the hospital until we get the test results. We need to turn those around. We have 8 at South Hospital. So that's a total of 22 beds with patients that are awaiting test results. I would turn those around. And in fact, what we're doing now is we're shipping those to Cleveland. They're processing, we're overnighting that process for those inpatients. But we'd like to be able to offer that to everybody. In fact, I mean, if under ideal circumstances, we would be, in my opinion, we would be doing mass testing of the public, even of asymptomatic people, to try and get our arms around that. If you look at the countries, South Korea is a classic example of that seems to have bent the curve dramatically by doing that early on. I'm afraid in this country the genie's already out of the bottle when it comes to that, though.
So you said that we have 300 tests pending. What's the turnaround time now from the time that the patients are swabbed and the test results are confirmed? There's
not a logic that I've been able to determine. The day before yesterday, I know we received a ton of test results for tests performed on the 17th, but I still had a number of tests outstanding from the 15th and 16th. And as far as I know, we still have tests outstanding from the 15th and 16th. And that is incredibly frustrating to those patients, and it is incredibly frustrating to us. All I can tell you is we are in daily contact with the lab, and we are pulling every string that we have at our disposal to get those turned around.
Sure. Thank you.
Commissioner Campy.
Mr. Lord, thank you very much. We appreciate your leadership. I know you're a local, born and raised here, so I know that your heart's with our community, and I thank you for that. 2 quick questions. One, I know that you said that patients that are in the hospital, admitted into the hospital for any reason, not necessarily COVID-19, but for any medical emergency, they are not allowed to have any visitors in the emergency room during intake and then once they're admitted into the hospital. Is your staff, I know how technologically advanced you all are, is your staff offering to ease some of the concerns of patients and their loved ones by working with them on the new technologies like FaceTime, Skype, Zoom?
Yeah, yes, sir. And under certain circumstances, we can also make some exceptions to those rules. Obviously, if you're dealing, for example, with an end-of-life kind of issue, we try to accommodate that.
I appreciate that. Thank you.
Any other questions? Thank you, Mr. Lord.
Thank you.
Oh, wait a minute.
I imagine if we can model some of our water technology and things that in place, maybe Cleveland Clinic or someone has a model where if this continues at the rate of multiplication it has, what does that, how do the beds sit on the facilities? And if it were to increase, probably the worst case scenario, or to perhaps recover, are we modeling how that is impacting us and, what that impact is on our beds and our PPE equipment, et cetera?
Yes, ma'am, that's a great question. The Cleveland Clinic has worked with some of our own modeling. I thank you for that question because I neglected to say the most important thing I could say here. I would encourage every member of our community to take very seriously social distancing. Wash your hands frequently. In healthcare, what that does is flatten the curve. So when you model this and you assume 20% effectiveness of social distancing and hand hygiene versus 50%, the numbers change incredibly. And if we do not do a good job of that, the models suggest we will overwhelm the healthcare system, not only here, but every place in the country. And all you have to do is look at New York City to see what's happening there. That potential exists everywhere, and I look forward to receiving some more information. I hope that the Department of Health has something maybe they can share, or others. Our own modeling, though, suggests that under any scenario, it will stretch the resources of our system, and if we drop below, say, 40 to 50% effectiveness of hand hygiene and social distancing, we'll be looking for alternative sites of care. And obviously ventilators and personal protective equipment and all of that. So I would beg our community to take this very, very seriously. Thank you so much.
Okay, Ms. Carol Ann Vitani from the Health Department.
Good morning. Thank you, Commissioners. Good morning. Thank you all. I'm Carol Ann Vitani. I'm the Health Officer for the Florida Department of Health here in Martin County. I want to thank all of you for giving me this opportunity to speak to you briefly, to give you an update. I want to also thank our state, local, all of our officials, all of our community partners, nonprofit organizations, and you, the community, mostly, for all of you who are practicing those prevention messages that you've been hearing over and over again. So as Mr. Lord has said, the Department of Health has been working closely to monitor the COVID-19 virus, and we have been actively working for the past 3 months with our community partners to ensure that the most up-to-date CDC guidance is quickly disseminated throughout the community. So I would like to just give you a big picture. As of last night, 6 p.m., in Florida, there were 4,950 total cases, 4,768 positive cases, 633 hospitalized, and unfortunately 60 deaths. In Martin County, currently, as we see on the board, we have 27 confirmed cases, 26 residents, and 1 non-resident, and 3 hospitalized. As test results continue to come in, we will see these numbers increase. The information is updated twice daily on the floridahealth.gov dashboard. That's at noon and at 6 p.m. Also, in addition, daily, we have been working very closely with our assisted living and long-term care facilities. I have a team of nurses that are calling them on a regular basis every day. Yesterday, the state and ACA sent an EMS team to facilitate and to provide additional support and unmet needs to those facilities as an added protective mechanism. We are in frequent contact with our urgent cares, our rehab facilities, dialysis, and our jail. We have doubled our epidemiology team to increase our surveillance and contact tracing. And critically, the most important thing, as everyone has said, it's everyone's responsibility to prevent the spread of this virus, and that includes practicing those prevention messages, practice social distancing, stay at home as much as possible, especially if you're 65 and older, and have a compromised immune system or chronic health conditions. Avoid touching your eyes, your nose, your face. Constantly wash your hands. Wipe down those surfaces. We know this is challenging for all of us, but it is necessary to prevent the spread of the virus. So please continue to also to support our seniors, which are our other vulnerable population, by offering to shop for them so that they may limit their exposure. Also, the DOH call center, the Department of Health in Martin County has established a local call center to answer questions. That number is 772-221-4000. It's option 9. That line is active Monday through Friday, 8 to 5, and on the weekends we also have an on-call system. The State Department of Health call center is in place 24/7 to answer questions. That phone number is 1-866-779-6121. Or also, residents can email 24/7 COVID-19 at flhealth.gov, And of course, always refer to the CDC guidelines. Thank you.
Thank you. Any questions for Karen? Yes.
Good morning, Caroline.
Good morning.
Just curious, I was trying to explain to somebody on the phone the other night about how to get directly to the dashboard from your site. Is there a way, instead of there's 3 or 4 clicks that you have to get through to get to Martin County, is there a way we can sort of hotspot that and just one click it goes right to the dashboard instead of?
I will definitely talk with our IT team, and I would imagine we could do that, sure.
It just, I think, just,
Let me
I was
find out.
screenshotting the different pages to go, to get to where you needed to get to. If they could just like take Indian River or St. Lucie, Martin, and give like a hot button or a hot link that would take them right to the dashboard page.
I'll bring that back to my team and
That'd be
make
great.
that recommendation.
Thanks.
Okay, you're welcome.
Any other questions? Okay, thank you very much.
Thank you.
Chief Schobel, like I said in my opening, you were, do you have anything to add?
Thank you, Commissioner. I'll be brief. Bill Schobel, Martin County Fire Rescue Fire Chief. I just want to assure you that business is operating normally out there for all the first responders in Martin County. We have no hindrances of responding to calls in any way, shape, or form. I'm very, very proud of our folks. They act without hesitation, and is that better?
Tip it up, maybe.
Try not to touch anything. They act without hesitation, and they continue to run the calls that are they're tasked with. We are taking measures to protect our first responders as they have been across the nation. We do temperature checks, medical screenings, and so forth twice a shift just to make sure none of our folks are getting sick, because obviously they're in close proximity in our close quarters acting as crews, so if one of them gets sick, they can infect the entire crew. So we're taking measures to assure that they are protected. Again, I'm very, very proud of each and every one. I'm proud of the citizens out there that are heeding the recommendations of CDC and Department of Health. It's very important that you heed those recommendations. I know I'm echoing the comments of every other speaker that's been up here, but you have to do it. Treat every surface as though it's contaminated. Treat every person as though they're infected. That's the easiest way to heat off this virus. So with that said, any questions? Thank you.
Thank you, Chief. Okay, next up, School Board, Ms. Marsha Powers.
Very specific information to cover. First of all, as mentioned earlier, we started our digital learning this morning, and I want to give kudos to our teachers, our staff, our parents, our students. This was a monumental task to create an alternative learning environment for our students in such a very short amount of time. I know there's some kinks to work out. Today everybody is feeling the pressure today. But we will continue to adapt and change as we need to, as we embark on this new learning environment. So students who did not have access to a laptop, desktop, or tablet at home were asked to report to their school last week to pick up a laptop from the district. Due to demand, we provided 1 device per family and deployed approximately 6,000 devices to students in 3 days. The majority of our high school students already had a device issued to them through our Laptops for Learning program. Our ET department has established a dedicated tech support email address for students and teachers, mcsdlaptops@martinschools.org. Students and teachers should use this email to address and report hardware, including damage, software issues. ET will also operate on-site support stations at Hope Sound Elementary, J.D. Parker Elementary, Port Salerno Elementary, and Warfield Elementary, Monday through Friday, for issues that are unable to be resolved via email. Our Food and Nutrition Services Department continues to serve meals to all children age 18 and under in our community. More than 5,000 meals were served during the first week of the meal distribution program. Meals are available at Jensen Beach Elementary, J.D. Parker Elementary, Hope Sound Elementary, Port Salerno Elementary, and Warfield Elementary. Children do not have to be present to receive meals, but families must provide documentation of the children that they are picking meals up for. Our dedicated coronavirus webpage contains important information for families about the digital learning process. There are videos and written tutorials for accessing and using Google Classroom, ClassLink, and many other resources. Students and parents are asked to reach out to their child's teacher via email with questions. If teachers are unable to immediately answer the question, they will pass the inquiry on to our appropriate district staff to obtain an answer. We understand that this is a very uncertain time for our families and community. We want students and parents to know that we are here to support them. Our digital learning plan is available at martinschools.org /coronavirus info. And it contains a great deal of information that addresses many frequently asked questions. School site administrators will be available to continue to assist students and families with their needs. We encourage families to take a deep breath, continue to practice social distancing and other universal precautions, and take things one day at a time. We're all in this together. So thank you very much for allowing me to speak today. Any questions?
Any questions?
I have a comment.
Yes.
Ms. Powers, as a parent of two teenagers, 8th and 9th grade, I just wanted to commend, the district, the board, the teachers, staff, from the top to the bottom. What an amazing job you have done. We were one of the families, went through your drive-through to get a laptop. We had a technical difficulty with it. I emailed your helpline. Within an hour, they emailed me back. I went back and got another laptop and have 2 students, teenage boys, at home doing digital learning right now. And who would have ever thought that when they popped out of bed this morning that they actually wanted to go to school? So we keep in mind that, everybody is navigating an uncharted process, and I think it's going to be difficult on many, but I think you have done such an amazing job, a Herculean task in a very short amount of time. So
Thank you very much. Can I just add one more
Sure.
thing? The Early Learning Coalition, we're here to support first responders and healthcare workers. If you're looking for childcare, we do have a lot of childcare facilities that are still open, servicing our community for those citizens that still continue to work. So if anybody has a childcare need, please reach out to us. We'll try to help place children in facilities that are open and operating in Martin County.
Thank you. Okay, now we're going to move to public comment. Please repeat your name when you get to the microphone, as I will probably mess it up. Miss Lori Prim. I think I got that one right.
You did, and I wasn't even planning on being here today, and here I am going first. I'm trying to... I didn't think I could be here today, but the main reason that I'm able to be is because of the Martin County School District and the job that they've done in getting our kids ready. I have a son in middle school and a daughter in elementary school, and I thought there's no way I can go to this meeting on Monday morning when I'm getting them set up to start this. My husband was able to be home, and they got on this morning and just started. And the amount of contact that we've had from the district in the past 2 weeks, the school district, has been amazing. They're constantly keeping us updated. They immediately had the meal plans in place for people who needed it. And the computers, like Stacy said, we drove through and the Pinewood teachers gave us what we needed and told my daughter how much they loved and missed her. And, I can see the school coming together as a community, and that's been really great. And I can't thank the school district enough, and the teachers, especially, always the teachers, for everything that they've done for our kids. So please, everybody, be aware of that. I emailed the commissioners last night since I thought I wasn't going to be able to be here, and I'm just going to kind of go through those points. Stacy, thank you for getting back to me on that. My concerns include 4 things that I'll try to keep brief. The first is testing, testing, and testing. It's the only way we will have accurate data from which to formulate plans and actions now and in the coming weeks. Number 2, consistent, accurate, accountable reporting from reliable, honest public health professionals and sources. Florida's number of cases is currently doubling twice a week. The public needs to be educated regarding exponential growth and what numbers mean today and what they will mean in the upcoming weeks. Importantly, how are we preparing for this surge in Martin County? And it was great to hear from Mr. Lord today, and I look forward to more updates to the public from him as we move forward. Number 3, widespread sheltering in place. Piecemeal does not cut it. We are each only as protected as our least protected. In order for sheltering to be effective, everyone must participate, excluding, of course, essential medical and related institutions. The longer we don't do this, the longer we're going to feel the brunt of not doing it and have to continue to do it. Number 4, personal protective equipment. Our healthcare providers must, I can't even say must enough times, have adequate supplies for their own safety and for the safety of our community. If they go down, we go down. This should be non-negotiable, and pressure should be placed on Governor DeSantis and every level of government necessary to make sure that this happens. Again, I was glad to hear that right now Martin County seems to be doing okay with supplies that they need, but we know that that's going to get tested. Further, hospital beds, including ICU beds and appropriately staffed, trained staff are essential. I trust you are in close contact with Martin Cleveland in
time's up, ma'am.
preparation and urge you again to
Ma'am, your
pressure
time's up.
any
Thank
level
you.
of government necessary. Thank you for holding this meeting, and I urge you to continue to act swiftly
Please, your
and
time's up.
aggressively. Thank you.
Okay, next is John Page, and let's please try to keep our 3-minute.
Thank you. My name is John Page. It's really a privilege to be here today. I'm so grateful for having this presentation and seeing that you are beginning with all of these statistics. Myself, I really love numbers, and my life is governed by a lot of numbers. I'd like to point out just a few things, and I'm really supporting a lot of what Lori Prim just said, and also what our speakers have said today. One thing is just about the numbers. You know, Palm Beach County, they have 383 cases right now. And the sad part about looking at numbers, including deaths, is that we're not seeing numbers that we're seeing numbers of people that were experiencing their first symptoms in early March. So our numbers are always going to be about 3 weeks behind unless we get caught up with our testing and make it a greater turnaround. We all have the same goal here, and I appreciate the diligent efforts and the honest efforts of everybody who spoke today, and also the commissioners who asked great questions and made a significant comment. I'd like to see a continued reporting of statistics like this. Lori mentioned doubling about every 3 days. This has been going on for weeks. 2 weeks ago, about 350. Last week, 1,200 cases. This week, 5,000. Next week, 20,000. It's not necessarily what the number is today, but again, what's it going to be 2 weeks from now and beyond? And for that, I appreciate the efforts of Mr. Lord in seeing that our hospitals are prepared. Widespread testing. This epidemic doesn't have to be an invisible enemy. If we don't have the numbers, we don't know how to plan. And that's also how I appreciated Stacy's comment about hospital beds and things that our hospitals are going to need. One thing about numbers is I really love on TV when I see Governor Cuomo saying, you know, we need this, we have this, we have that. You hear the hospitals on TV saying, we have this, we need that, but they're doing it with numbers. So in future communications, that's something that I'd like to know, because I think the better informed the public is, the more we can adequately respond to it and take the seriousness of social distancing. I'm trying to modify, considering everything that's been said. But lastly, a shelter-in-place order is the only effective tool that we have, and maybe that's within the scope of this county. Just this last Saturday, there was a restaurant in Hobe Sound which apparently had a booming takeout business, I suppose, because there were so many people seated outside at tables, close proximity to each other, and I could look through and see people inside, but it was a drive-by situation. So we're seeing this social distancing not being taken seriously because the public doesn't know. The public is still hoping that it's not us or it's not them, it's going to be the other people. There was a storefront church across the street from where I live, packed with people.
Time's up.
So again, just to emphasize,
Please, your time's up. Thank you.
social distancing and shelter-in-place orders.
Carol Dietz?
Try the other, huh?
Huh?
You didn't try the other lesson.
No, I didn't.
It's okay.
I'll leave that up to you.
It's okay. Good morning, everyone, and thank you for allowing me to be here. I'm Carol Howard Dietz from the United Way of Martin County. Thank you for giving me this opportunity and for all that you're doing for the safety and well-being of our community to get us through this pandemic. I'll keep my comments brief, which is hard for me to do, but I wanted to share with you what the United Way of Martin County is responding to the COVID-19 and how we're collaborating with other local nonprofits and government to help Martin County residents in need. We all know that people are struggling in the economic wake of this pandemic, and in the weeks and months to come, more people than ever will be scrambling to cover their basic needs, such as food, housing, utilities, healthcare, resources, and more. To help local individuals in need, we've launched the COVID-19 Economic Relief Fund and allocated $200,000 from our emergency funds to help people right here in Martin County. We anticipate the need to gather significantly, and we've been able to raise an additional $50,000 in contributions from corporations and individuals. I want to stress to everyone that 100% of every gift will go towards helping our community. We will not be taking any administration fees. We're working with 2 local nonprofits, agencies who handle the case management for this fund, House of Hope, which Rob Renier is here, thank you, Rob, and Salvation Army. I've said this many times, COVID-19 is something that our local community, our nation, and world has never seen before. It is going to affect people and businesses that have never had to ask for help. I strongly believe that we have to work together and let those organizations that it is their mission year-round to provide this assistance to take the lead in helping our community now, which is why we chose House of Hope and Salvation Army. Additionally, we're working with Martin County funders to support established local nonprofit organizations that are the frontline responders. Grant requests are vetted by all funders to ensure that resources are allocated to nonprofit organizations in a strategic manner to organizations with a proven track record of helping the most people as efficiently as possible. We have agreed that during the initial phase of this pandemic that the United Way will focus on the immediate needs of our community members, and the other partners will look at operation support for our nonprofits. We're also working as a volunteer coordination arm of the Martin County Emergency Operations by coordinating all volunteers so that we'll be able to account for all the manpower it takes to help our community and to keep it going. We continue to keep residents informed of local resources of where you can turn to for help through our website, social media, and email newsletter that can be found at unitedwaymartin.org. Please know that we are a resource that is here for you, and thank you again for the opportunity to speak.
Thank you. Mr. Troy McDonald.
Good morning. Thank you. Troy McDonald for the record. First of all, I just want to thank all of you and all of the Martin County staff. I think you guys have done a great job of keeping us informed and keeping us informed both through social media and through other sources. So thank you. The reason I decided to come and speak this morning, I think it's as we are moving forward and we're seeing this fast changing data, we're learning things every day. At some point, there may be time to act for a stay-in-place order, and in the consideration is I'm a small business owner. I've been deeply affected by this. I'm not opposed to a stay-in-place order, but there are a lot of businesses out there that are currently operating as if there is nothing wrong. No social distancing, no sanitation, no hand sanitizers, and this is what concerns me. We need to get the message out to these businesses that they're not helping. And the sooner this is over, the sooner we all can get back to work. Again, thank you for everything that you guys have done. I appreciate it very much.
Thank you, Troy. Sarah Torres.
Good morning. My name is Sarah Torres. I am with the Boys and Girls Clubs of Martin County. Thank you for allowing me to be here today to just quickly share a little bit about what the Boys and Girls Club is doing for the community in need. Our focus right now is twofold. We are making sure prepared food gets to kids and making sure prepared food gets to their families. Our plan is to continue supporting the available meal resources from the school district by delivering to areas in the county where we know that families and kids are unable to pick up the breakfast and lunch being provided in the school locations. Excuse me. For example, we are picking up meals from Hope Sound Elementary School and transporting them across US 1 so that families who have no other way to get across can get meals on a daily basis. We are also providing prepared snacks and dinners in the late afternoon and early evening to kids and families, whether or not they are affiliated directly with our clubs. These are prepared meals. We are purchasing the food and paying for preparation, packaging, and distribution, as well as using our buses. AmeriCorps members and staff are also used as appropriate. We are deploying these same AmeriCorps members to other agencies to assist with their efforts. We use our 4 clubs as the distribution sites for afternoon meals. We are also delivering these meals where we know folks can't get to our clubs. These are places like Banner Lake, Petway, Hibiscus House, the Mount Zion Baptist Church, among others. What's different about what we're doing? Current USDA distribution is restricted to children. We are making sure that the families get food too. We are focusing on prepared meals, as we know that many of our families living in poverty may not have access to things like a refrigerator or a stove, or have the time or knowledge to prepare the meals. We also realize that it's likely that many kids are being left on their own in the afternoons as their parents are at work. Many of our agency colleagues throughout the county are focused on packaged food and groceries. We did not want to duplicate their efforts, which is why we are providing prepared foods. In addition, we're looking at the possibility of opening our doors for children of essential workers, first responders, and whose families work for Cleveland Clinic. And we are in the process of rolling out our virtual club. So beginning next week, children will be able to log on to our website and our social media platforms and receive regular club programming. Thank you.
Mr. Rob Ranieri.
Good morning, Commissioners. Just a quick update for what's happening at House of Hope since our last meeting here. We're up about 30% in new clients right now for food distribution. So today we'll likely go over the 200 mark in the number of financial assistance requests for people looking for support with rent, utilities, car payments, things of that nature. As we get past the first of the month, we expect the number of financial assistance requests to increase rapidly. Thanks to United Way and their fund, we're able to meet those needs through Community Foundation and some other local resources. There's additional opportunities for us to continue to be able to fund those direct needs for clients throughout the county. So that's ongoing. We're also continuing to have success in food procurement. So not just for the 4 House of Hope pantries, but also for the 15 or so agencies that we support, local soup kitchens, church pantries, things of that nature. We can continue to provide them the resources they need to be successful for their clients. So far we have not seen any dramatic shortages or changes in food availability. It's getting tighter, but it's still moving to where everyone can meet the need as it's presented. The prepared meal, like what the Boys and Girls Club just presented, and what's happening at the fairgrounds, those things definitely have value that take a little bit of pressure off of agencies like mine in food support. So those are all good parts of the process. We hope that those will all be able to continue as we get deeper into this. And then in closing, I just want to say, not just House of Hope, but all of the nonprofit agencies that know what the challenges are and what the risks are and hear all the health updates. But every day they get up, they get in, and they go and take their positions and man their posts and do what they have to do, especially for the more challenged folks in our community. So, everybody gets a lot of credit, deservedly so, around first responders and the teachers and all those wonderful groups. But every nonprofit agency has people going above and beyond right now, doing jobs they've never had to do before because it's an all-hands-on-deck approach, and likely will be for many weeks to come. So tip of the hat to all of the partner agencies that we work with across the county, and a big thanks to the county for the work they're doing too through the EOC, are participating in those calls each day and finding out about a lot of resources and opportunities to assist through that network. So, this is going to be a marathon, not a sprint, so hopefully everybody can continue to be successful in their lanes and assist each other as we're going forward. Thank you.
Thank you.
Elizabeth Barbella.
Good morning, Commissioners. Elizabeth Barbella, President and CEO of the Community Foundation Martin St. Lucie. 2 weeks ago, we announced to you that we were putting together a funding consortium. That funding consortium has met twice already. We have already vetted and seen hundreds of thousands of dollars in requests from local charities. The difficult message today is this. Obviously, there has to be prioritization. Basic needs, keeping our citizens safe in their homes, healthy and fed, are going to take priority during this process. All of the requests that we've gotten obviously are not going to be able to be fulfilled. It's difficult because we live in paradise right now, and we want to protect paradise and all the vital charities and not-for-profits that make this a great place to live. We're really encouraging charities right now to stay in their lanes. We are looking at organizations who on an annual basis are providing services so they can take their systems and deploy the resources, which are limited, in a very, very strategic capacity. As Rob said, this is a marathon, not a sprint, so our human and financial resources being metered out is essential. We're collecting data. Today we're launching a food survey because this seems to be a point of confusion throughout the community, to ascertain how much food we have coming in, how long it's going to last, and at what point we might run out, so that we understand whether we need to actually be spending money on that or not at this point. And we'll continue to do that as we see gaps in the needed services to keep our residents safe, obviously our most vulnerable, children, elderly, our developmentally disabled. So this group, which has now grown to 12 public and private funding entities in the community, will continue to look through that lens, knowing that when we make it through this, we will help pick up those other charities that are vital to our community and try to help them move forward. But right now, looking to sustain those that are on the front lines, the first responder organizations that can rapidly deploy resources to our citizens, is going to be the focus for this group. Carol, my colleague, mentioned it, so we are active and underway. And as we continue to put these small surveys out on a weekly or biweekly basis, we're happy to share that data and information. We'll do so with staff so that it can inform if we need to come to the county for help and backup and advice regarding bringing resources into our community. So we're working really hard to make this an organized and coordinated system with a high level of communication. So thank you to all the funding partners, and thank you to all of you for your interest in this, and we will keep you informed.
Thank you so much. Yes. Oh, hold on a minute.
Ms. Barbella, I want to say I appreciate very much that the fact that you're doing some surveys and collecting data, and you're using that data to determine, what are the next steps. So I appreciate that you're driving some of those decisions on data.
Thank you. We're just encouraging those who are listening, who are being asked for that data, to respond as soon as possible. We can only react based on factual information, so it requires everybody's participation to deploy the resources properly.
Thank you. Harold?
Yes.
Are you going to stick around for a few minutes?
Yes.
Thank you.
Okay, Mr. McChrystal.
Good morning, Commissioners. Thanks for your service. The numbers from the South I saw on TV this morning are kind of scary, so it seems inevitable that we're going to get slammed. And I would hope this episode would remind us of why we want to stay different than what's to the south of us. Also, I think it'd be a good time to really start cataloging what is truly essential spending versus non-essential spending for the future, because the real tsunami is going to be the future economy and the future budgets. All right, thank you.
Thank you, sir. The sheriff has come into the room, and I have one commissioner that has a question, and if you've got something you'd like to say. Sheriff Snyder.
Administrator, Commissioners, good morning.
Commissioner Campy.
Sheriff, thank you very much. When I saw you come into the back of the room, I was very appreciative. You know, all of us, I'm assuming my colleagues and I, are receiving emails and social media posts, and some people have suggestions and some people have concerns. Two questions for you. One, as you're well aware, we did close our county-operated boat ramps for Saturday and Sunday, except for licensed commercial fishermen and other professionals that are licensed to do business with their boats. And I was wondering if your deputies had seen any decrease, increase, or what was the status out on the water, if there was a noticeable difference over the weekend. Is my first question for you, sir.
Thank you, Commissioner. Yes, there was a noticeable decrease. The problem we have with making a really coherent statement is that the boating traffic prior to this week has been influenced greatly by the spring break phenomenon. It's beginning to subside now. So we best estimates, and I sent a text copy of a video, I think it was, to our administrator. The boating traffic, I would say, we probably had 500 boats between our two sandbars, and that is less than it was before we instituted the closures of the boat ramps on the weekend. Probably we had 3 times that many the week before we instituted those closures.
Is there a number, 500 to me sounds like a tremendous amount of boats still. Is there a number that's appropriate where people can have that level of social distancing? Like what would you, I know it's a weird question, but what would you assume is the capacity out there that's still distant? I know it's a large, especially depending on the tide, it's a relatively large piece of area. What do you think?
I hate shooting from the hip, but if you did 500 boats, it was an average of 3 to 4 people in a boat. It's usually a couple thousand people between the two sandbars. As big as it is, I think trying to keep social distancing in an area that confined with that many people is an enormous challenge. The other problem is, unlike being on the land where we can walk up to a crowd and say, hey, would you move? It's a boat. So we swing around to one side of the sandbar, move a little crew around. By the time we get to the other side, that crew has gone back together. The other problem is a lot of them are young people, and they feel like they're bulletproof. So the entire schematic of trying to keep social distancing on a sandbar on a weekend is problematic.
I would agree with you. Thank you, sir. The next question is, there's a lot of people that have reported back, even some of our public comments this morning are talking about residents that are witnessing what they would consider larger groups or not practicing social gathering. Do your deputies have any authority to drive around and if they see groups or house parties or people at businesses or churches and disperse them? Is that within your jurisdictional powers?
The short answer is sort of. There's always two ways to police and to enforce good behavior. The most important one that we use is moral persuasion. I'm in a uniform, I come up to you and I say, would you please move along? In Martin County, 99.9% of the people will do what I say. So yes, if we see a group of people not adhering to the best practices of social distancing, we can just say, would you please move along, and they will. The question then recurs, what happens if we have a group that doesn't want to? Right now, we have no arrest authority to enforce any of the directives from the governor, and we have no directives here yet, so does that answer the question?
Yes, it poses another one, which is when your last comment that says you don't have any authority from here, is that something that you would look for us to give you guys the ability, or do we have that option? I wouldn't imagine, but I'm not a legal expert on these issues. I think your first point where you said if deputies roll up in uniform in deputy vehicles, most of our residents, I would say nearly 97-8% would be like, very well, thank you. You know?
Yeah, I spend a lot of time out. I move around a lot. I'm not seeing people gathering. So our restaurants are all following the rule. There's only takeout in Martin County. You've dealt with a lot. There's a lot of businesses that for their own protection have closed. So we're not seeing, probably the biggest gatherings I see in Martin County are at Publix, looking for toilet paper. So there's, I think Publix are moving towards plexiglass and spacing and, things like that. So a lot of this feels to me in Martin County, unlike, say, Palm Beach County to our south, which is so much more urban, so much bigger, so much more impersonal. They seem to require more government action to keep people behaving themselves, whereas in Martin County, I think we probably have a lot of room left before we need legal authority to enforce social distancing.
Thank you.
Any other questions for the sheriff? Sheriff, thank you for what you do.
You're very welcome. Thank you.
Okay, next is Commissioner comments. Commissioner Hurd.
Yeah, I hope that this isn't the end of our discussion. My hope for this meeting today was that we were going to discuss how we were going to, up until Saturday, participated in daily conference calls, updates, and those were discontinued on Saturday, which is a real shame because that's how I was getting information. And now, since we're not going to be participating in that, how are we going to get information? This is going to hurt us informing our public. It's not hurting us, it's hurting everybody in our county if we can't get information, all 5 of us, and we can't disseminate it. So how are we going to deal with this new prohibition?
Well, Commissioner Hurd, we envisioned it the same as we've gone through with hurricanes, where the commissioners are able to go to the EOC in person. Unfortunately, individuals who have access to commissioner calendars, my calendar, Ms. Wood's calendar, everybody who had that information coming in were calling in, and they were putting their phones on speakerphone. I witnessed that myself. And so when we can't, when people can't get in because we have over 200 participants on there, and we're trying to have that conversation with you as commissioners, it's very difficult. So for today, we had the 10:30. I do have the ability for us to call in because this meeting went longer than what I had personally anticipated. But that was the plan, that you would be physically, just like we do normally when the EOC is activated. The commissioners have the ability to go to the EOC, be there in person, social distance, and hear the information. We also were in a compromise situation where the individuals who were providing information were reluctant to then speak. And that was frustrating for the rest of the commissioners that were looking for information.
So there's still going to be daily updates at the EOC for certain constitutional officers and emergency services personnel.
And commissioners.
And then what are we going to do? Are we going to have daily press conferences, or how are we then going to get the, because there are, according to Mr. Lord, currently there are 300 tests pending. We don't know if we're going to see a spike. It sounds like some of the tests that were performed 2 weeks ago have not been reported back yet. So we really don't know where we stand. So how are we going to get that information out each day? We can't rely upon, as Commissioner Smith said, going to the very circuitous route of looking for the number of confirmed cases on the state's health department's website. We're going to have to do something a whole lot more in order to keep our residents safe and informed. So what are we going to do?
Well, that's a discussion I think the board needs to have. You know, I was contacted over the weekend and told that the city of Port St. Lucie's mayor was pushing to have a shelter in place initiated. And if that happened, then of course St. Lucie County would be forced to do it. And I think then we're stuck with Martin County being in the middle of those two. I share the frustration of the general public relative to golf courses and pools and private boat ramps and all that people don't seem to be heeding the warning. But, you know, those are private entities. So we, as a county, have closed the public access to the best of our ability, trying to limit individuals having the ability to, because they're not practicing social distancing. So we've done what we believe we can do. I think, as you heard the sheriff, it's hard to enforce the shelter in place. I mean, I spoke with the county administrator in Palm Beach County. They're not using their police force to go around, or their code enforcement to go around and force businesses to close. They may go in if they see that there's individuals there and ask them, you know, what it is, and then they see there's 1 or 2 people in the office and they're 20 feet away, they're letting them continue to operate. So enforcement is a real challenge for us. We are lucky to have the sheriff work with us, or we would not have been able to close those boat ramps over the weekend. We had people moving the barricades, taking it upon themselves to go ahead and go into our boat ramps, even though we said they were closed. Our employees were being put at risk, and until the deputies show up and people realize that we're serious, they don't heed our warnings.
What ability do we have? Should we make the decision to shelter in place? Do we have the ability to make that determination? And then do we have the ability to enforce it? And when do we make that decision? If we can make that decision as an unchartered county, then what's the trigger?
I can take that question, Sarah Woods, County Attorney. The Emergency Management Act from the state, as well as our ordinance, allows us to take some actions. I will tell you that I spent some time looking at all of the other counties that have done either shelter in place. Another concept is called Safer at Home. I will tell you, even in the most populous counties, they really are following, I think, what the sheriff enunciated, which is it's important to kind of use social pressure and give recommendations, and that mostly you can give instruction and direction and information to try to get voluntary cooperation, and that's what I'm seeing in all of these orders. But in general, the less draconian declarations are safer at home, and it sets forth the concepts of social distancing and recommending the CDC requirements and recommending that listing the businesses that are essential and trying to give really gentle guidance. And there are some ways for us to enforce. The statute gives us that, but I'm not seeing that anybody's really using it. Many of the safer at home recommendations don't have a penalty attached right to them. They're just giving law enforcement the authority to remind them that that's in effect. But again, subject to board direction, we can do what you need to do. I'd suggest in close consultation with the sheriff, because in the end, and I want to stress this, the county's declaration is what sets the rules for the entire county.
Including
We are in charge,
municipalities.
including the municipalities. The municipalities can pass things that are stricter, but whatever we pass, the municipalities follow, and requires all of the municipalities' law enforcement to follow that as well. So that's in the state law.
I live in Rocky Point, and at the northeast corner of Rocky Point is one of the finest parks that we have, Twin Rivers Park, and it's been really, really widely used by residents over the last 2 weeks, and people are being very, very conscientious about social distancing. But I hear comments from people as I pass through saying, oh, the next thing that's going to happen is they're going to close the parks because parking is becoming problematic. What's Martin County's policy on keeping the parks open? Because they are, it's a way to keep residents physically and mentally much safer and healthier.
And we agree with you, Commissioner Hurd. What we're hearing from the governor's office and others, and even with the sheriff, some of the upticks in statistics are because people are in close proximity in their homes now, and they're not used to doing that. So they have asked that we continue to leave our parks open as long as we don't see where there's those large concentrations of individuals. We would not do something that severe without me and Ms. Woods contacting each and every one of you to give you a heads up on where we are, but we've been looking to the sheriff to help us make those decisions. When they become to the point that he can no longer effectively manage and his people start being put at risk, then that's when we have to take that more severe action. That's what happened with the boat ramps. That's what happened with the beaches. People were unfortunately not adhering to the requirements by CDC, and we felt for their safety, we had to take those measures.
Thanks.
Commissioner Campy.
Thank you for those responses. I appreciate them. I know that all of us have been challenged with this. This is a difficult decision. It's not an easy black and white one. I did have an opportunity over the weekend to individually speak to some of our colleagues up in St. Lucie County and in Indian River County, because I strongly believe, as they do, that we really should focus our attention as the Treasure Coast. You know, when we compare ourselves to Palm Beach County, I think most people are aware of the fact that Palm Beach County is 10 times larger than Martin County. Our sisters are St. Lucie and Indian River, and I was happy that at least for the 2 or 3 commissioners that I spoke to in each county are feeling and sort of comprehending the same scenario that we are. Their situations are nearly exactly the same. They want to balance the concept of safer at home and stay at home with the financial health of the overall financial health of their communities. And they've also, believe it or not, you know, we're on the first line of folks that are now regulated in Palm Beach County. They said, well, we'll go to Martin. But they're also, believe it or not, going all the way up to Indian River County as well. And when I was talking to some of the commissioners, they have said that they regularly get folks that come from South Florida up to enjoy amenities in their communities. So one of the things I've heard over and over, and I'm not even sure that it's an option, and I'm not asking to make it an option, I'm purely asking for the feasibility of it. I'm assuming my fellow commissioners have heard people that have said, you know, especially now, the next line of defense seems to be golf courses, especially for me in Palm City. It's a very quick ride up 95 in the Turnpike. There are several private golf courses that are open to the public, which sounds confusing, but what I'm saying is they're not our courses. They're not county-owned and run courses, but some of them are still public open to anyone to come. And some of the neighbors that live along the courses and some of the folks that utilize these courses have been frustrated by the influx of residents from the south to come. So and then of course when we did the boat ramp issue, there was people that said, well, why are Martin County residents being punished if there's a huge, if we're being overwhelmed from residents from down south? Why don't we make these facilities Martin County residents only? I didn't have a logical answer for them because I don't know if that's a thing. I did visit a couple of the golf courses in Palm City over the weekend. I did notice that I went to 4. 3 of the 4 were doing a very good job of sanitizing and protecting their clients and their employees. I was very impressed with 2 of them in particular, were doing an excellent job. One of them, not that I'm a health expert, but we've been involved in enough meetings and heard enough things that I did give them some suggestions. They were pleased that they were still open because, like Commissioner Hurd said, there is something to be said. I think we have to focus our attention as commissioners. It's easy for residents to have an individual point of view because it's a personal point of view. The 5 of us don't get the ability to have a personal point of view because we have to take everyone into consideration. I think about the physical health first and foremost. I think we all are, and most of our meeting was about that. We could have a full nother meeting on the mental health of what's happening in our community, especially young people. And those young people are being hit twice, one by complete disruption of their life, and many of them are going to be now cheated from all of the milestones that they would have had in their lives. Are all basically off the table. But when their parents are also struggling, either loss of job or fear of how they will pay their bills in the future, quite often that is taken out on the kids. Not all the time, but quite often. But I also think it's important we focus our financial health. I've had a lot of businesses, I'm assuming my commissioner colleagues have the same, that said, thank you very much. We're appreciating every additional day that we get to operate our business. We can keep our employees on the payroll, and we can continue to offer services to the community. The thing that I'm concerned about, if we were to step it to the next level, and I think we've made smart decisions as a board and a staff thus far. First, it was the beaches, which we tried as hard as we could to work a reasonable strategy. First, it was just Hobe Sound, then it was the rest of them, and then we realized we had no choice. Then it was the boat ramps, and then what we did is we closed them just on the weekends, which would assume a lot of folks that have access to their boats Saturday and Sunday, and then we're looking to see if that works. Then there are some other, those are our businesses. Those are the things that we control. I asked the sheriff that question on purpose because a lot of folks think that, and I saw some people nodding, the sheriff and his personnel can't see everything that's happening at every restaurant. Residents are everywhere, they see things. And so are they to call 911 and say there's a restaurant that has 12 cars in the parking lot? I don't know what the answer is. And he gave us basically his recommendation. I'm personally not in favor at this moment doing that complete closing because it tips the scale in another direction of a lot of domestic violence incidents go up, a lot of attempted or sadly successful suicides increase. I'm not saying it's happening specifically here in Martin County, but it is happening. And we need to be addressing those issues as well. So it's not an easy decision. I'm glad we had the meeting today. I wanted to hear from my colleagues because it's a fine line, but I would tell you, and I also agree with what Commissioner Hurd said, we need to have regular updates like this, but not for us. We can call you and get specific information. We need to continue to engage our public. You know, I know that some of you are frustrated that I have been engaging residents via my social media platforms, and I'm going to continue to do that because the most frustrating part for me is when people ask me for information and I don't have an easy way to share it with them. I'm getting the information from the administration, the hospital, and the health department. I need to share it. Now, maybe we have different visions on social media platforms. I know that our staff, our internal staff, has done an excellent job of putting that information out. But I know in Palm City, there's Palm City Moms and Nextdoor and a lot of these other platforms that I don't know if the county administration and their staff can be present on every one of those platforms, but we can. My final comment, Mr. Chair. I saw someone posted this. over the weekend, and I thought it made excellent sense as someone who was in New York City and lived through 9/11 in the months in the aftermath. When this is all over, what we will remember is how we treated each other. And so I think that that's very important for us to remember. Thank you.
So my question is, I feel like the board had an update, what you would normally hear on that 10:30 call-in, unless there's something specific that you would like for me to see if I can get. As you know, those normal call-ins was an opportunity for the health department to update us. As you heard, we had one additional case, and then for Cleveland Clinic. And so if you want to break and call in, we can do that, or if you want to just keep going, it's up to the pleasure of the board.
Say we keep going, but
You're the chair.
That seems.
Is there any way that they can postpone that meeting for half an hour? Most of the people that are important are in this room.
Well, I asked that
Not
question.
all.
I know, but there's other constitutional officers and elected officials that are also on that call.
But
So
I wonder if they would accommodate us by waiting half an hour.
But if we've already heard the information, kind of what's.
No, that's fine. I don't mind.
Okay. Okay, I like the safer at home concept. Commissioner Smith. Oh, Commissioner Hetherington. Just ladies first, I'm sorry.
I would echo some of Commissioner Canby's comments. I was actually disturbed this weekend to have some phone calls and emails from residents, particularly from golf courses. Now is not the time for our surrounding counties that have a stay-at-home to flood to our Martin County golf courses. There we closed our public course, and I have friends in the golf, and our general managers and golf pros here in Martin County, and many of them are practicing what the USGA put out, and they're doing one per cart, and they're doing members only. But some of them, as Commissioner Campy mentioned, are taking an opportunity to have some of the busiest times that the residents have seen. I think it's completely inappropriate. It puts all of us at risk. And I just heed to the industry itself to go to its colleagues, and I've told some of them on the phone, one bad apple, and that's all it takes to ruin the entire bunch. Because I'm not opposed to going to the governor and asking him, for an order if this becomes an out-of-hand problem like it has. I just think people should pay attention and heed the advice of the Department of Health. We're all safer at home. I agree. Safer at home is the best place. Boat ramps, 500 does seem like a lot of boats to be congregating on the sandbar. If you want to go fishing and you want to have your own spot, great. But if we could just pay attention to this advice, it's quite disturbing to me. My 14-year-old, somebody mentioned earlier that some of the biggest crowds are at Publix. It's great. Get the supplies you need and then go home. I see people going in and out like it's a social outing. And my 14-year-old is working, a couple hours a day. And it's terrifying to me because you shouldn't be going even out to Publix as a social outing. Get your supplies and please practice these guided or best practices at the health department. I heard Mr. Lord from Cleveland Clinic earlier talk about some of the modeling, and I would love to hear more of that information, but I think that we just have to really encourage folks to heed the stay-at-home and the best practices, because that's really, really disturbing. And then I agree with some of my colleagues. We have to constantly share information. I was also disappointed to hear that we wouldn't be calling in. I think that the more information that we can give the public, the better understanding, because it's an uncertain time for everybody. So the more information they have, the better they can also make decisions, and hopefully that encourages them to heed the advice. So that's all I have.
So on the golf course issue, there is a difference between a public golf course and a private golf course, for one. Two is, I I received a number of calls from different golf courses begging for us not to shutter them. One of the biggest proponents of that got a call from this morning that says that he's closing his golf course down. It is open to the public and has been completely inundated. So somewhat self-correcting, but anyway, go ahead, Mr. Smith.
So I guess I'll start off with that because that's the conversation of the last 10 minutes. I guess we've all received calls from golf courses. I have too as well. I think what was interesting is that the call that I got on, I guess it was Saturday, was that Friday and Saturday's numbers had doubled on one particular golf course in the county, private. And a majority of those golfers were from out of county. And I think the concern from the individual calling me was that, we're doing what we think is right to do here with our residents, and our residents, generally speaking, are doing the right thing. But if you have hotspot counties from the south coming up to do whatever activity, whether it's going to our boat ramp, whether it's going to the beach, whether it's going golfing, there has got to be a way to sort of shut that down. So my recommendation to the individual was, look, you live in a gated community. I don't know what authority the gated community has over the ability for those individuals to come in and go from their association. But if it continues at that rate, which is clearly putting their residents at risk from folks from other communities, there must be a way to shut down the entrance of out of resident ability to access those neighborhoods. I don't know that homeowners associations have that right. They have guardhouses. Most of them are gated. And I suspect that if you're not a resident, they can say, thank you very much, but we're only limiting access to our residents as another alternative to that. I too I wished that we didn't have to shut the beaches down. We did. The next level was I wished we didn't have to do the boat ramps, but we did. Golf courses seems to be the next larger public gathering area, and parks, as Sarah said. The reality to this whole thing is that if we can control Martin County's communication and ability to manage our residents and get the message out to them, that's one thing. But if we can't control the out-of-county resident impact on us, that's an entirely different, I think, perspective in terms of how we do try to manage all this. As all of you have said, and I think the best advice that all of us have been given, whether it's nationally on the news or people that are dealing with the state EEOC call or whatever, is that to the extent that you can limit your exposure to other people, do it. I mean, if one thing is going to help us the most, as much as we enjoy doing all these things, and for a lot of us, it's the reason why we live here, and it's the hardest thing to stop doing it. Because that's going to, the numbers are one thing, and the numbers will continue to decrease or they'll flatten out. Whatever they're going to do, the numbers are the numbers. The only way to change the numbers is to change the behavior of what we're doing publicly. And it's hard. It's not easy to do. And so I guess that on that. So that's the golf course issue. One thing I would like to talk about is this whole nonprofit issue. I have received, as I'm sure all of you have, lots of different emails from different nonprofits wanting to do funding drives and so on. We've had both organizations that are our larger structured organizations, if you want to call that, come forward and talk about how they're trying to work together. I think it's incredibly important that we don't mess this up, and I think there's a really good opportunity to mess it up for the long haul. Maybe in the short term it all seems kind of the right thing to do, sending out messaging, we need to raise funds because whatever reason what we're doing is we think is the right thing to do. However, coordinating that and keeping that structured, I think, is super, super important at this point. What I don't want to see happen, and there is certainly the opportunity for it to happen, is that a request goes out for funding, and then the funding isn't spent in the place that we would like to see, or we think that that organization should be spending those funds. The backlash from that later on down the road, in my opinion, will have damning effects to all of us that participate both in the nonprofit world, but also to those that contribute in larger significant funds. And so you mind if I ask Elizabeth to come back up for a second?
Please do.
Elizabeth, if it's all right. I think relative to, we have reporting entities that are reporting to us on a daily, weekly basis on what we're doing and how we're best managing, whether it's fire rescue, whether it's the EOC or whoever. We have two really great, strong individuals in the room relative to our nonprofit world. And I think the ability to coordinate that effort and make sure that we're messaging in a single streamed message for all of our nonprofits, I think would be super, super important. And I asked Elizabeth to come up to share with us even a little bit more about how we might best do this so that we don't mess it up. I don't know if we need to go so far as to say we need to appoint someone to represent the nonprofit community to work with us at a county level, as if you were a staff person or somebody were a staff affiliate. But I think it's one of our probably most pressing issues relative to the whole social distancing and keeping people apart from each other. It's the whole nonprofit thing. And to the extent that we don't step on each other and we don't get in front of each other, and one organization over here thinks it's doing the right thing and really trying hard at it, but right over here another organization is doing the same darn thing, and the funders get confused and the people that are looking to put money to it get confused, and then we're not as effective in the nonprofit sector as we should be and could be. And we are incredibly lucky in this county to have that sector that we do. I would add one other just thought to that Elizabeth, before you have any additional thoughts on it. I talked to some folks about our other organization in town, the Children's Services Council. I don't know if you've all had any communication with them one way or the other. They're discussing putting out a significantly large chunk of money out into the community. Okay, but what does that mean? And is it going to the right place? Do we know that it's being fully, really vetted to the level with you all that are in the funding level side of this thing? And do we know that that money is going to go where it's really most needed? I just think we need to have a conversation about that and understand if there's any role for the county to play in this, and there probably maybe not, other than having representation tell us what's happening and how it's being done, I think would be most helpful. So, and then I have two other questions if Elizabeth could at least comment on that. Go ahead.
I think I would just hearken back to what I shared with you earlier. It was very deliberate and strategic to pull this funding group together, and it's gone beyond what we even expected because now we have larger private foundations joining us in the conversation. Part of the point in doing this was, yes, to strategically position resources, but it was to very quickly be able to pull together information so that we would see in real time gaps and needs in our community as it related to the services provided by the charitable sector. So our goal is week to week, really. We're almost at the point where now it's becoming every other day to continue to update the data by which we're making decisions on. So yes, the Children's Services Council is at the table. It has a $2 million reserve. It's a significant resource. Typically, its programming is directed toward children and families in the community prenatally through 21 years of age. Obviously, in this conversation, we're talking about best use of any of those funds that are released, so that if there are, for example, services the Children's Services Council can cover, how do we strategically use other funding sources to cover things they can't? That's the level of dialogue that's happening on a weekly basis with this consortium that Carol and I are both a part of. When the Community Foundation stepped up to organize this, we realized very, very quickly there was a lot of good information and a lot of not accurate information about what was readily available in our community. And then very rapidly, there were a lot of folks trying to figure out very quickly about how to focus and concentrate on populations they had direct contact with as their normal course of service. So ultimately, this is requiring a level of collaboration and partnership. We're fortunate here that many of our not-for-profits have already been working together very closely, but this is ramping it up at a whole other level. And now the message coming from the local funders is, you must do this now, and you must start to communicate with us in a way that is very focused on the response, the rapid response to COVID-19, knowing that basic needs, health, and mental health are going to need to be prioritized. And so we've been gleaning this information every week, and when we don't have what we need, we've been reaching back out into the sector. This is the beauty of being small enough yet big enough. We know who the leaders of these organizations are, and we can pick up the phone and call them to get concrete information by which to make strategic decisions. Ultimately, this will be millions of dollars worth of resources in our community. And to Commissioner Campy's point, Community Foundation is also looking through a multi-county lens, which is critical because our residents move between county lines, and we have providers in the charitable sector that are already sharing information and resources because our families live, work, and play in multiple counties on the Treasure Coast. So we're not just myopically looking through one county lens, and we look at what is and isn't happening in the sector.
So, Mr. Chair, I would ask that at least on a weekly basis that we whether it's a verbal update or at the EOC, that Carol and Elizabeth give us a real-time understanding of where we're at. And so that we have the confidence as people are reaching out to us and asking us for something, which they are doing, that we are confident and that we understand where we're at with our nonprofit world.
I completely agree.
Can I just add something that Elizabeth's not going to say, but I will? It would help if you all helped us by educating, 6 feet. Sorry, Elizabeth. Educate the community about what we're doing so that they make intelligent decisions on their charitable giving also. Because there's many, many donors in our community that want to help. So if they would consider working on the funds that we are working with, so we have a holistic approach, and that's really key.
I think that's exactly to my point. In the communication side of this thing, I think the communication period is a whole nother category. I think is something we have to talk about. But I think it's exactly what Carol just said, the importance of getting this out so everybody's on the same page and everybody's working in a single linear focus versus kind of a shotgun approach that people are kind of all over the place. I think at the end of the day, people's money will be spent much more effectively if that's the hope. And that we also have the organizations that are best slotted to doing what they're supposed to be doing or should be doing. Again, they're doing that piece versus stepping over somebody else that's doing the same thing, but over here.
Yeah, you have two organizations that are working very closely together. Both of us have COVID-19 response funds. We've been on and off the phone and on email pretty much every day and in the evening. We're getting calls from individuals, very generous individuals in our community that quite frankly are concerned. They want to give, they want to support, and we need to continue to encourage that. Not because it's our goal to necessarily control anybody's decision, but to provide them with factual information so they can make educated decisions on how they support what's needed in this community. So thank you for that, Carol.
Thank you.
And I think that's something that we can message along with the rest of our messaging.
And are you all in agreement with that? Like a weekly update would be helpful so that we can message out and that whoever's messaging messages a consistent, pointed message.
Absolutely.
Third thing, the small business, thanks, unless anybody else did. I don't know what they're exactly calling it, but we were on a conference call Friday or Saturday, with the Association of Counties relative to the federal stimulus package with Senator Rubio. I don't know if that has gotten out to the level at which it needs to get out, exactly how funds are going to be available to small businesses. What I would ask, and again, this is asking the board if you're interested in doing this, I called Denny Hudson, and because the stimulus funds are going to run for small business through our banks, and they're going to use the form and the format, as I understand it, for the SBA loan structure that everybody would be familiar with if you've ever used SBA funding. It's called a 7A, I believe is the number for the type of form. It's more using the form than it is exactly the SBA format itself. There's a whole set of guidelines that are going to go along that'll be much more streamlined, much more direct. but I think it would maybe be a good idea, and Denny has said whatever we would like from him. He was incredibly versed at exactly what was going on. They had been working on it for 2 weeks at Seacoast, and I think, unfortunately, we probably should have had him here today speaking to us, but also to the community, like, this is how it's going to work, here's how it's going to roll out, this is how you will apply for those funds. It's a fascinating, and it's hopefully it's going to be an incredibly streamlined system. So I think, again, I'm asking of the board, but the next time we do this kind of a meeting, I think it would be helpful maybe to reach out to Denny Hudson and see if he would be, like Rob has come and shared with us what the hospital is doing, what the banking industry is doing, and how this process is going to work, and how small businesses will be able to directly apply for those funds.
Mr. Chair?
Yes, sir.
No disrespect to Denny Hudson and to Seacoast. I happen to do some banking at Seacoast myself, but those funds and those advantages are available at every bank, correct?
Yes, they are.
Okay, I just wanted to be clear that it wasn't specifically just
No,
Seacoast.
and at no time did I indicate during my
No, I know you
comments
didn't.
that-
I just wanted to make sure some people.
But I reached out, just so you all know, I reached out to 2 other banks. They were not at all familiar. So the large national corporate banks have all been part of the structure for the last couple of weeks, building this program with the White House. And there was a conference call with Senator Rubio's office and the major banks in Florida on Friday morning as this is starting to unroll itself out. I just happened to, I called 2 other banks. They did not understand what I was talking about. They knew what SBA loans were, but they did not know this new process. And I also reached out to Denny, and Denny was incredibly articulate and had a very good working knowledge. I'm more than happy to have the banking consortium, if there is such a thing in Martin County, come and give the update.
No,
I just think for our small businesses, the amount of money that is going to be available and the amount of money that will be out there to help employees and businesses keep their businesses, pay their rent, pay their electric bills, water bills, and all the other things that are ancillary to running a business. It will not buy equipment. It is not like you're going to go out and buy a new refrigerator because your refrigerator is old. You can do that, but in a year there will be 4% interest, I believe was the number on that type of purchase. This is really intended to help small businesses, both employee and owners, to keep their doors open through the next
Commissioner
couple months.
Smith, to your point, Mr. Hudson is very well known, pillar of the community, very knowledgeable. He could be the perfect spokesperson for giving information on that. That's my opinion.
And lastly, just the thing on communication, one thing I would encourage all of us to do, my concern with all of us randomly or not randomly, but putting out our own updates on what's going on relative to all of this, is that we coordinate those efforts to the extent that we can through our staff so that the messaging is consistent and that we are accurate, and not that we all aren't hearing the same information, but that we are very careful that what we put out people listen to and they hold on to, and that it is as clear as we can make it. The worst thing that could happen is if we put out confusing information, because I would explain something one way, Harold, you'd explain it a different way, Ed, Sarah, and Stacy a different way. I just think, I understand that you're going to do what you need to do or what you feel you need to do, but the importance of us messaging consistently, I think, is super important at a time when there's still a lot of confusion out there on the internet and other sources. Thank you.
Thank you. And with that said, the small business loan thing is something the business community is dying for information. I, as a business owner, can't get that information. So anyway, I think our next meeting, we definitely should have a presentation on that.
Mr. Chair, can I just say one
whether it
other
also
thing
can
about
go, maybe the Business Development Board also should be involved with that. Go ahead.
Just the other thing I think everybody is concerned about relative to the rolling out of this program. The unemployment system is already completely capacity in terms of its ability to function and not function, to process unemployment claims and all. My concern is once this starts happening, that the banks will get very, very cluttered very, very quickly. so that the clearer we can make it. Denny also talked about they're working on an online application version that will be, and apparently it's supposed to be super simple to fill out. It's not like a regular SBA loan that is very complicated and you got to have an advisor. This is really, you need to bring in your proof of employment, your tax return from either 19 or 18, if you haven't filed your 19 yet, and that's basically what it's going to take to apply for those funds. Thanks.
Okay.
Mr. Chair?
Yes, sir.
If we're going to create an agenda item that has like some financial information in it, I think if we could track someone down that could also speak to, there's a lot of confusion for parents if you have your sort of, early 20-year-old children or late teen children at home. Do they collect the money if they file their own tax returns? Do they collect the money? Does the family collect the money if the parents are filing the child under their own? Students that are in college, students that have worked a certain amount of hours and made a certain amount of money, where does the money go? There's a lot of questions. I know this is a new thing, but I like the concept of a sort of, just as we do these other updates, the financial health of the community is important. So if we could include someone, I don't know who those people are at this point, but someone that's got a little kind of a working knowledge, because some of these decisions are going to have to be made soon. I also heard something that it's not a matter of how you filed for 2019, it's how you filed for 2018. So I mean, it's all coming in little drips and drabs. I think if we can consolidate it, people would appreciate that as well. Thank you.
And also maybe an economic update. I just got a text that reminded me of that. An economic update from the BDB and Career Source. I think that is also important to get out to the public. And so does Ted. So, yes.
I have a broad question. So we are going to receive daily updates at the Emergency Operations Center at 10:30 each morning. Those updates are extremely critical for all of us. So how is Martin County going to disseminate that information? Is it going to be daily? What time is it going to be disseminated? How is it going to be disseminated? Do we know those things yet? Because during hurricanes, we have press conferences every day at a certain time. Are we going to be following those same protocols as we deal with this epidemic?
Commissioner Hurd, we can have press conferences, we can have emergency meetings as much as the board feels they are necessary.
I'm just talking about daily updates. I think that residents need to be able to rely upon, there's going to be a daily update at this time every day. I can see it, I can watch it, I can read it from these sources. We just, I think, need some certainty for daily updates.
Commissioner George Stokas, Assistant County Administrator, will be more than happy to come up with a regular update. It'll probably be either through social media via YouTube or something through MCTV, as well as our website is constantly updated as we get those. So we'll put some type of link that we'll have. I don't know the exact time. It might be sometime, probably in the afternoon, because it takes us a while to put together a video.
Well, the Department of Health, George, we do know, is updating at noon and 6 p.m. We heard that this morning. So our numbers would automatically be updated shortly thereafter. So at least twice a day we know we would be updating based on those numbers that are being released.
Okay, and we just have to know how we're releasing them. As Commissioner Smith said last week, his mother doesn't use a computer, so putting it on YouTube is not going to help her. We're going to have to rely upon some other method via MCTV or something else in order to inform those people who are not going to be relying upon social media.
Yes, ma'am.
I agree. Okay. So where are we at? Are you looking for direction for?
Well, I think we can always call back another meeting if we get to the point. I'm seeing that the governor apparently at his press conference this morning made mention that he may put into place a South Florida Safer at Home initiative. Of course, they haven't said which counties specifically, or have they? Okay, so we've got from our news crews.
He's full of news. He can't
It'd
help
be
it.
Palm Beach down. So then I think the challenge again for us will be, as St. Lucie County and Indian River County make these decisions, that's why our beaches, that's why we made the decision to close our beaches and boat ramps, quite frankly, because they were closing them to the north of us.
Right.
Well, we collaborated. It wasn't like we were knee-jerk.
No, but they had already made the decision to close.
Yeah. no,
They
I
didn't.
think-
They didn't call us and say, "What do you think if we do this?" I mean, they
Well,
essentially.
they're going to do that from now on.
Okay, perfect.
So we're going to be prepared if and when something like that happens, that we can then follow suit and/or have our own safer at home program. Yes, sir.
Taryn, are you once a week, twice a week, and if you're not, having a joint call with Indian River, St. Lucie, and you?
Yeah, I reach out to them. Yeah, between Howard and Jason and myself, that's what we've been doing.
I mean, I think from what we've heard from every other part of the state and other part of the country, our region, and we've talked about it here this morning, functions together. And even though we have a fair amount of people that commute down to Palm Beach and south, what you just explained, what we do, they do, or vice versa.
Mm-hmm.
And so at least I think once or twice a week, maybe you ought to be touching base like on a given point in time prior to maybe like one of our 10:30 updates, so that at least we're getting an update from Indian River, St. Lucie as to what are they thinking, what are they planning, what are they doing, are they having the same issues that we're having?
Sure.
I'd like to add that the county attorneys in Indian River and St. Lucie and we've talked almost every day this past week. We are actively sharing our drafts and trying to remain consistent. So it's been a real collaboration, just as Taryn said.
If you can all just report on that to us, that would be helpful.
Ms.
Excuse me?
Christie, may I make a clarification? When you were saying that, based on what happened with the beaches or other decisions that we then do that, I know you didn't mean to say that we are just reacting to what our colleagues to the north are doing.
Oh, no.
We're collaborating.
Yes, we're collaborating, but they have county commissioners that are making decisions, and it's not always in their hands, just like the city of Port St. Lucie. The fact that the mayor has put it out there through social media that he's wanting to do this shelter in place.
But he's going to find out, obviously, that that's a decision made at the county commission level, not at the city level, even if it's a very large city. That's what I've heard over the weekend, that's a collaboration. We don't have those very large, but in Indian River, they have Vero and Sebastian, and in St. Lucie, they have Port St. Lucie and Fort Pierce. So they have a different kind of a dynamic there than we have here. We have a very good working relationship with our municipalities. They're also much smaller. Versus up there. I just wanted to be clear that people didn't think that Martin County commissioners or staff were only reacting to what our colleagues to the north were doing. We can lead our own way. I just think that the collaboration was. I'm very friendly with some of those, as all of us are with those commissioners up there, but I had not been reaching out. There's so many other people to reach out to. I had been focusing most of my attention and communications with our municipalities and our school district and the health department and the hospital. But having had at least hour-long conversations with them over the weekend, our issues are the same. So if we can collaborate, I think it sends a consistent message to all of our residents on the Treasure Coast. I mean, we already define it as the Treasure Coast. So with that in mind, if we collaborate, it looks very consistent because tons of our Martin County employees live in St. Lucie County and vice versa. So it makes sense that we would collaborate instead of having a sort of a checkerboard approach. One other thing, Mr. Chair, if you don't mind, separate from that, is I was thinking that when businesses are under the purview of the Department of Business and Professional Regulation, they are inspected. The health department, it's a common misconception that the local health department goes around and does health inspections of businesses to see how clean they are and if they're following the proper guidelines. That's not. That's the Department of Business and Professional Regulations that have inspectors that are located. Now, primarily they're doing restaurants and bars and food servicing establishments, but under these new circumstances, where we are still having certain businesses that are open, and we are hearing stories of people not practicing the appropriate protocols for sanitary and social distancing. Can you find out at the state level if they have expanded their inspection and I guess, regulatory capabilities to include some of the directions that the governor has given in terms of going in to see if they are following the new protocols of sanitizing and the gloves and the distancing and all these other things. I think that that might be helpful. I don't want to necessarily punish every business owner because there are some that are completely disregarding the policies and procedures that have been put in place. And I want our residents to know that this is a daily, day-to-day decision-making process. Just as we closed the beaches and then the boat ramps, we'll figure out what's happening with the golf courses. Although I want to remind people that are going to contact us today, we don't have the ability to just as a body, close someone's private business because too many people are there. We have to work within the framework that's appropriate. Just because someone likes that doesn't mean that we actually can do that.
Mm-hmm.
Thank you.
Okay.
Mr. Chair?
Yes, ma'am.
I just have a quick comment. Commissioner Hurd asked a very specific question about how we're going to deliver in communications, when we're going to deliver it, and I'm not completely satisfied with the response, although I'm not looking for a response right this second. I think we do need to come up with a plan on, with this change, how we're going to deliver it, how frequently, and we need to have a plan for that. And I'm not satisfied with we're just going to post it on social media and.
What would you suggest, Commissioner?
I suggest that we have a plan of how we're going to communicate, a crisis communications plan, a plan where we're going to disseminate information via press conference after each, tick of information from the DOH or something more so our residents can get that. And I don't think that everybody can get it from social media. So does that mean engage the media? Certainly. We might need to have more frequent press conferences as well.
Yes, we plan to do that. We just started launching with Commissioner Jenkins' assistance on Friday. He did kind of like an infomercial, and we plan on doing those. We may do them more often than
The only downside is that the way to put that out there is via social media.
Well, we put on MCTV.
I understand. I think the question is official press conferences, and if I might make a suggestion, Commissioner Hetherington, I think our staff would have to reach out to the media, because if we said, as Martin County is going to have a 4 o'clock, I know that they do, but this is a new question, if to reach out and find out what the appetite would be if we held a daily 4 o'clock press conference. If the media is not able to attend, then we're having a press conference for each other. If we should find out what ability our media would have, what appetite they would have to hear information from us, because obviously that's the only way. I know that our professionals are putting it out in every option possible. They can only present the information that we are giving them. So if we were going to have a daily update, if you will, like a personal daily update, that wasn't going to be exclusively delivered via social media, there's only 2 other options, the newspapers and the TV media. So it's, as great as we are, it's not the governor and it's not the president of the United States. So I don't know how much coverage we would get until we ran that out. So it's not an easy question for a small county. I've been doing town crying. I stand on the corners at night in Palm City and I yell the news out.
Go ahead, Mr. Smith.
During the hurricanes, we were very successful in scheduling block time with the various media outlets, both radio and TV. And so I'm sure with our local support crew that takes care of us on our TV stations, that we could work out a block time with them, that we're not competing with St. Lucie, we're not competing with Indian River. There's twice a week or something, that there's a pre-established time that's convenient for them, that sets them up for whether it's the noon hour or the 4 or 5 o'clock hour. I'm sure there's a way to work that out with them to make sure that the most current weekly information that we can give them.
Agreed, and I think we can work on that. Right. Okay, any other comments? Ms. Grizzly, you have anything else?
No, sir.
Okay, with that said, our next meeting is April 7th and April 21st, May 5th, and May 19th, unless we have another emergency meeting, which I suspect we might. So with that, we're adjourned.